Congratulations on your acceptance here at Cal State Nursing Program. It's awesome that you got in here.
Woo!
Welcome to our sim lab. This is where you will be able to experience a live scenario. You get to practice your skills, and this is an environment where it's for learning. So if you make mistakes, feel comfortable, you'll learn from them, and you'll never do them out in the hospital with real patients.
And you can always feel like you can take your time in here, you can ask questions. It's so nice that after the sim experience you get to do a post-conference, go over things that worked, things that didn't, maybe some changes you would make. And it's really cool because you get to see how your other classmates would handle situations. And so maybe even if you weren't in the room as part of the experience, you can relate whatever they did out in your clinical experience. So we always act like this is our patient, and then we get to run a scenario with a few students in there, and that helps us practice all of our skills that we've been learning, you know, in nursing school, like taking blood pressure and giving medicines. Like, so back there we have a little like computer station, and that's very similar to what we have in the in our hospital settings, and that lets us get into the charts and get into the medications, and it's really neat. Yeah, they really have it nicely set up for us so that we can practice a lot, you know, because we can't always practice on patients like that, you know, and this allows us to take our time, ask questions, and then afterwards we go in here and we all sit and chat about it and congratulate everyone for doing such a good job, and maybe offering up suggestions for what we can do better next time. So it's pretty cool, huh? And it's cool because this is like, you know, where the pilot sits, you know, like in an airplane they control everything.
So when I first got in and I was introduced to SimLab, I personally was very excited because I knew what it was about already. I knew that we get to practice before we actually touch real patients. And I knew that the course, reading the syllabus, it was going to be slowed down so you can take your time, make some mistakes, that's what it's all about. You're going to learn from your mistakes and take them and do the accurate and better job in the real clinical setting.
I really enjoyed my sim experience both years that I have been here at Cal State East Bay. I can remember my very first class and how nervous I was and just very scared, and I'm actually a person who's pretty outgoing and loud and not afraid to speak in front of people, but this was a whole different realm because, you know, I was being watched by not only just my teachers but my classmates as well, and we were being, you know, kind of critiqued and on what we knew so far, and I just felt so scared and very
You'll feel more comfortable here, and then once you go out into the clinical setting, you'll be able to talk to your patient and you'll be able to do things for your patient and not feel very scared when you first walked in. I was really nervous during my first sim, and we were learning vital signs. That's something that as a level 3 now we're able to do in about 2 minutes and still assessing our patients from head to toe without.
Sim was a struggle because every day you're out of your comfort zone. Every time you're in this room doing a scenario with your classmate, you are out of your comfort zone. So if you're shy, you're going to get unshy real quick, and if you feel inadequate, well, you're going to prep your butt off on the day of sim to make sure you know what meds does what and all the, you know, all the pathophysio.
Just really appreciated over the years that they've been supportive and that the experiences or the simulations have gotten, you know, increasingly more difficult and challenging, and
you really have a lot of fun in here too, but you get to learn a lot, and the constructive feedback that your classmate and your instructor gives you at the end are very, very accurate, and they're usually very helpful for you when you're in a clinical
I
setting.
think that it's really great that we get to be in such a small group, because not only do we all get to kind of be a part of it, but you just get to know your classmates a little bit more, and you form better relationships. And
So by the time we got to the end of level 3, we were doing code blues. We were ready. Barbara and Eric will set you up. You will be ready to handle any sim experience. They won't give you anything that you're not ready to handle.
in here.
So-
But what I learned from Barbara and Eric was that by taking your time and really thinking things through in sim, will carry across to the clinical experience, and that has been something that's been very valuable to me.
Good luck with everything. Have fun with sim, and don't be afraid to ask any questions and feel comfortable.
Good luck!
Good luck!
Good luck, level 1s. Hope you enjoy your time
Take care of this guy or gal, whatever he or she might be.
that day.
Have fun, learn a lot, and if you're nervous, just imagine everybody in their underwear in here. And everybody needs bedpans.